So like I said, my name is Alyssa Nava. I'm a prevention specialist at DECA. I am grateful to be with everyone here today and be the presenter who gets to share this topic with you. To start off, I am going to begin with a gentle invitation to join me in this topic. So I invite everyone to engage with this webinar in a way that prioritizes your well-being. I welcome you to turn off your cameras, take a break, step away if you need to. I acknowledge that the content of this presentation may be difficult to read, hear, or learn about, depending on your own life experiences. My goal is to try and create a brave space for us to learn and expand our understanding about the science of adverse experiences. So, okay. So to begin, this is an overview of what we are going to be talking about today. We're going to go into talk about the background of ACEs, the impact of them on our health and wellness. And then I'm going to go ahead and jump into talking about what we know about the current prevalence of ACEs within Kansas, and then end, hopefully on a more positive note, about how we can work in our communities to balance and prevent them. So by the CDC, the definition of ACEs refers to the experiences that someone has in the first 18 years of their life. And this all comes about from the original ACEs study, conducted in between 1995 and 1997 by the CDC and Kaiser Permanente. Primary care physicians at a clinic in Southern California were really interested to understand what the relationship was between childhood experiences and adult health outcomes they were experiencing and seeing with their patients. And so what they decided to do was to have this study. They sent over 17,000 participants confidential surveys asking about their current health status in health behaviors, and then also surveys that asked about past childhood experiences that they had. And one thing to note that I like to point out about this original study is that the population that really started this entire area of research was primarily a white middle class, middle income population. So when we start to talk about where research has gone and the broader understanding we have of the impact of ACEs, it's going to make a little bit of sense why we now have a deeper understanding of how ACEs impact minority communities. And so this brings in the ACEs questionnaire. I'm sure that many of you have run across this questionnaire if you know anything about ACEs, but the original questionnaire asked about 10 specific childhood experiences. It focused on asking about emotional and physical neglect, 3 different types of abuse, and a combination of different household challenges that a child may have experienced. So that's looking at parent separation or divorce, substance abuse in the household, mental illness in the household. So these are what are traditionally identified as the 10 original ACEs. And the major findings of this study continue to play out in all the different studies and data collection that's being done. And so what we know is that ACEs are extremely common. Almost 2/3 of participants reported that they have experienced at least one ACE in their childhood. We know that there is a dose-response relationship between ACEs and a negative health and well-being outcomes. And so what this means is as the number of ACEs increases, so does the risk for negative health outcomes. And visually, if you look at this graph, a dose-response relationship creates this really easy to see stair-step process. And the last major finding that we're going to talk about is how I alluded to earlier that research has expanded to study adverse community experiences, adverse climate experiences. So we know that some populations are more vulnerable to experiencing ACEs because of social and economic conditions where they live. So on this graphic, you can see that it's not necessarily it's not just related to how people self-identify, but it's related to things such as high school education, the amount of money families are making within a year, unemployment. And so a lot of what ICES has shown us is that it's is that these health outcomes, I'm getting a little bit ahead of myself here, the impact in health and well-being, so many of the increased risk for these poor social outcomes are related to not just how someone identifies. It's not just talking about the individual. It is going to go ahead and focus on those other community and cultural aspects of someone's life. So ACEs research shows that experiencing a higher number of ACEs is associated with many of the leading causes of death and chronic disease. I like this graphic because it shows the wide breadth of health and social outcomes that have been connected with ACEs through research. However, to be clear, having multiple ACEs does not mean that you will have these various conditions or that you will eventually develop them. As we know, there are complex layers to health outcomes for adults. However, the research does reflect that those who experience ACEs, even if they have experienced one ACE, they do have an increased risk for developing these various conditions when we compare them to people who have no ACEs. So it's important to be clear because there is so much potential when we think about how can we buffer or how can we help children, adults who have experienced an ACE in their lifetime, to see how can we help them not end up with these different health conditions, mental health conditions, or even end up in some of these social outcomes that we know are really detrimental to people's health. And so again, this is another really great graphic that just shows how adverse childhood experiences can impact and does impact such a wide range of outcomes that as people who work in prevention, we are probably working on. And so that includes injury, mental health, maternal health, risky behaviors is something that I know here at DECA in my position that I work with communities on, and even those social opportunities. ACEs is really just this, from the research, this is all based on that we know that for people who have experienced an adverse childhood experience, they are at a higher risk compared to a population that has never experienced it. And so this brings us to what new research is out there. And so here on the slide, I have our original 10 ACEs, and the National Scientific Council on the Developing Child actually expanded its definition of adversity beyond these three categories to include community and system sources, because we know now that adversity is not just 10 simple things. We can't really just make a checklist and be like, these are the only adverse events that we need to be focused on that can have these health impacts on an individual. So with expanding the view, the research has identified things such as living in an unsafe neighborhood, involvement with the foster care system, spousal abuse, witnessing acts of terrorism, natural disasters, as other adverse experiences that show that same dose response that is going to be connected to those same health outcomes as those original ones. And so this is really where the new research lies. And I think it's a great opportunity when we think about how can we, as people in prevention, move forward and do more with our communities. So this is one model that has come from this new research. It's called the Pair of ACEs tree. This comes from the Building Community Resilience organization. And this graphic was developed to illustrate the relationship between adversity within a family and within a community. So in this model, the leaves on the tree represent ACEs that children and other family members have experienced within the family unit. The tree is planted in poor soil that is steeped in systemic inequalities, keeping the tree from accessing the nutrients necessary to support and build a healthy foundation. This leads to withering leaves on the tree. And I think that this visual really provides that, it provides that understanding of, if we're thinking about how family units are trees, and a community has lots of different trees, if some of those are planted in poor soil where they're experiencing poverty, violence, poor housing, lack of opportunity, those trees are not going to thrive the same way another family elsewhere who is not encountering these community environments is going to thrive. And so I know I really like this tree, and it really goes into this other really popular graphic that is very well known within the ACEs community, the realm of ACEs. So this, again, looks at those different levels that research has told us about. You see the tree, household, the soil, again, is the community, but it adds this extra layer of how we think about the environment, natural disasters, climate crisis. I think this even includes pandemic on there. This really just gets to that higher level of all the different things in our environment, the severity of them. They do translate into these adverse experiences that we've been talking about. And that really ties in to what, hopefully, I feel like this is such a buzzword these days, what we know about the social determinants of health. And so when we're talking about that, social determinants are the conditions in the environments where people are born, live, learn, work, play, and age, and it affects a wide range of their health, functioning, and quality of life outcomes. So this model here, it's called the social ecological model. It considers the complex interplay between the multiple layers of personal environmental factors. And this just really allows us to visualize what social determinants of health are telling us, and directly related to ACEs, about how we can really say that ACEs is one of the most, if not the most powerful social determinant of health that we currently know about. So we can see, just looking at this visual, that at no point does an individual or their family or their social circles exist on their own. There's always going to be that complex interplay of where are they living, what are the norms in their community, what is available to them in their community, and by proxy, what does society and policy and the greater understanding of how we function as communities come into play. It's going to steps, as you see, it goes all the way back down to how that individual is experiencing their life. So I think that this model is really great for us within prevention and anyone who's doing this type of work to really understand how can something such as big as policy, or something that's happening in the community, or even on this wider end, this circle that you see, how can issues such as social justice and environmental justice play back into how an individual is experiencing their community and their life as they grow. And that leads us to this part of our presentation, is about toxic stress response. And so I'm going to spend a little bit more time here, really just to help us understand what is the science behind ACEs. So we, when we're thinking about, yes, if someone is growing up with adversity, maybe it makes sense to a lot of us, like, yes, they are, as an adult, they're going to have a harder time coping. They're going to have a harder time, navigating life compared to someone who doesn't experience adversity. But the really cool thing about ACEs science is that we can look at this specific topic of toxic stress response to understand what is actually happening to our bodies when we experience adversity. So the National Scientific Council on the Developing Child coined the term toxic stress to describe the effects of excessive activation of the stress response system on a child's developing brain, immune system, metabolic regulatory systems, and cardiovascular system. And this toxic stress response really exists on this spectrum that they created. So on one end, we have positive stress. This is a normal, essential part of healthy development, characterized by brief increases in heart rate and mild elevations in hormone levels. So this could be the first day that a child goes to a new caregiver, or maybe the first time you get a shot at a doctor's office. Then we have tolerable stress. So this is activated as a result of severe long-lasting difficulties. So this activates the body's alert system to a greater degree as a result of these longer lasting difficulties. If the activation is time limited and buffered, then the brain and organ are able to recover from experiencing these higher levels of stress in our bodies. And then on the very other end where it gets its name is toxic stress. And this occurs when a child experiences a strong, frequent, or prolonged adversity without any adequate support. And it's activated by strong, frequent, and or prolonged adversity. So toxic stress occurs either continually or it is triggered by multiple sources, and it can have a cumulative toll on the individual's physical and mental health for a lifetime. And so on this end, we're thinking of experience such as those original ACEs, physical, emotional abuse, accumulated burdens of family economic hardship is one of those examples that I talked about that new research really points to. And it's important to note when we're learning about the toxic stress response that the body's stress response does not distinguish between overt threats from inside or outside the home environment. So our body physiologically just recognizes that there's a threat and activates the body's response system. And again, that goes right into understanding that this continuum that we're talking about refers to the stress response system's effects on the body. This is not talking about whether or not we consider the stressful event or experience to be toxic. This is really getting down to that level of understanding about how our bodies, like it says, brain, immune systems, regulatory systems are reacting to encountering stress. And so this leads us into stress response activation, which is really getting down to how do all these things interplay? And the foundation of ACEs science. So at the top here, I have a spectrum of different life experiences that someone could have overlaid with our stress spectrum. So like I said, with positive stress, it's maybe getting a shot for the first time, seeing a caregiver, being with a new caregiver, all the way to those toxic stress experiences, having a parent with severe mental illness, experiencing the death of an adult in your life. And in the middle, where this tolerable range is, are other experiences. Maybe the first time you travel and you go, you take a long flight. Another one could be living in an area where maybe you don't experience natural disasters, but you live in an area that has a lot of different environmental climate events occurring. And so overlaid with these two things is this final aspect of stress response activation, the spectrum of a supportive adult relationship that helps the child adapt and cope with adversity or buffer the impact of these adverse experiences. So as I've kind of alluded in other, like on the last slides, when we're talking about children who are staying within this toxic stress response system, when we're talking about children who are staying in this activated toxic stress area, maybe we're talking about that they are experiencing a number of these. They live in an area where there is constant different environmental climate experiences happening. They also have experienced the loss of a loved one, or they are living with they live with a parent who's experiencing severe mental illness. They end up near this toxic side of it. However, if they had at the bottom a supportive adult relationship who could help them cope and understand and work through those events in their life, maybe they move out of a toxic state and they go towards a tolerable one. Their body is able to move out of toxic. It's able to deactivate that stress response to where they're not going to be staying on this other end. Really the key here, and as we talk about ways that ACEs can be prevented and buffer, it really comes down to the supportive adult relationships that kids can have in their lives. And when they lack one and they're unable to get the support they need to adapt to adversity, they stay in this toxic state. And that is really what we're seeing when we're talking about the science of ACEs. And because I could not do justice, I'm going to play this video that talks about brain development and ACEs, and hopefully this sheds a little bit of light and maybe is a little bit clear on what I was talking about for toxic stress response.
Science tells us that the experiences we have in the first years of our lives actually affect the physical architecture of the developing brain. This means that brains aren't just born, they're also built over time based on our experiences. Just as a house needs a sturdy foundation to support the walls and roof, a brain needs a good base to support all future development. Positive interactions between young children and their caregivers literally build the architecture of the developing brain. Building a sturdy foundation in the earliest years provides a good base for a lifetime of good mental function and better overall health. So just how is a solid brain foundation built and maintained in a developing child? One way is through what brain experts call serve and return interactions. Imagine a tennis match between a caregiver and a child, but instead of hitting a ball back and forth across a net, various forms of communication pass between the two. From eye contact to touch, from singing to simple games like peekaboo. These interactions, repeated throughout a young person's developing years, are the bricks that build a healthy foundation for all future development. But another kind of childhood experience shapes brain development too, and that's stress. Good kinds of stress, like meeting new people or studying for a test, are healthy for development because they prepare kids to cope with future challenges. Another kind of stress, called toxic stress, is bad for brain development. If a child is exposed to serious, ongoing hardships like abuse and neglect, and he has no other caregiver in his life to provide support, the basic structures of his developing brain may be damaged. Without a sturdy foundation to properly support future development, he is at risk for a lifetime of health problems, development issues, even addiction. It's possible to fix some of the damage of toxic stress later on, but it's easier, more effective, and less expensive to build solid brain architecture in the first place. One of the things that sturdy brain architecture supports is the development of basic emotional and social skills, an important group of skills which scientists call executive function and self-regulation can be thought of like air traffic control in the child's mental airspace. Think of a young child's brain as the control tower at a busy airport. All those planes landing and taking off and all of the support systems on the ground simultaneously demand the controller's attention to avoid a crash. It's the same with a young child learning to pay attention, plan ahead and remember, and follow lots of rules. Like all of us, kids have to react to things happening in the world around them, while also dealing with worries, temptations, and obligations on their minds. As these demands for attention pile up, air traffic control helps a child regulate the flow of information, prioritize tasks, and above all, find ways to manage stress and avoid mental collisions along the way. Having this ability is a necessity for positive and level mental health. Developing effective air traffic control, overcoming toxic stress, and building solid brain architecture are things kids can't do on their own. And since strong societies are made up of healthy, contributing individuals, it's up to us as a community to make sure all young people have the kinds of nurturing experiences they need for positive development. To build better futures, we need to build better brains.
Okay, I really enjoy that video. I think it does a really great job of helping us, and I mean us as in anyone who is working with people who's doing prevention, understands how brain development really is going to impact how we function as adults and how other people who maybe have those different experiences than us process things as they're adults. So one more thing here before we get into talking about ACEs in Kansas is the ACEs pyramid. This represents the conceptual framework of the original ACEs study. It was created as a tool to understand how adverse childhood experiences impact individuals across the lifespan from conception to death. And This is from the CDC. This is the newest pyramid. These three areas where the arrows at have been added from the original pyramid. And by asking the question, how can ACEs shift the frame of disorder to distress when we're thinking about adoption of health risk behaviors? This pyramid reimagines it, being informed by the trauma-informed framework to help us understand and utilize emerging research on how ACEs impacts an individual. So by adding these bottom layers of historical trauma, social conditions, and local context that predate an ACEs occurring, we're really being able to understand those community and societal potential factors that are at play. And then thinking about how when someone is adopting a health risk behavior, we're thinking about it in adoption as a coping mechanism, which really I think gets back and really ties well with what we know now in research related to substance misuse and other health risk behaviors. And so I'm going to pause here. As promised, if anyone has any questions they'd like to share, feel free to unmute. Just kind of providing an opportunity here in case anyone wants to ask something about the previous slides. Okay, so like I said, feel free to dump any questions into the chat. We do have someone who is looking at that. So our next step here is, okay, so we know all this information about ACEs. What do we know about ACEs in Kansas? And the really cool thing is that we can look to the behavioral risk factor surveillance system, which I think a lot of us are probably familiar with. It is an ongoing population-based survey of adults 18 years and older. The survey's been coordinated by the CDC and conducted annually in all 50 states and other US territories. This allows us, this really allows us to look at a wide range of information. I mean, these surveys have so much, but the cool thing about it is that in 2008, the CDC released an optional module to assess the relationship between ACEs and health status at that population level. And in 2014, Kansas included it in the BRFIS for the first time. And that gave us what is currently the newest report out of Kansas on adverse childhood experiences among Kansas adults. And yes, recognizing this is 2014 to 2015 data, but actually in a little bit of digging, this specific ACEs module was not included for a few years after this. They were originally included in 2015, but I was able to see that they included this module again in 2019 and 2020. So fingers crossed that we will be getting the results of those two surveys from those 2 years and be able to get a better idea of what ACEs looks like in Kansas right now. But since this is what we have, I do want to review what we do know. So the CDC module on ACEs focuses on two of these categories. So it's asking them about household challenges and abuse. These questions do not include the 2 questions on neglect, which is why you don't see 10 here. So looking at this, we see that roughly 1 in 4 adults experienced parental separation or divorce, emotional abuse, and substance abuse in the household. These 3 ACEs are pretty significantly more experienced within this population who was surveyed. And what it found, so this sometimes is hard for me to wrap my head around, but so when we're looking at ACEs data in this viewpoint, we're really looking at it retrospectively. We're asking adults what they experienced in their childhood, and we're saying that we know that they currently have these health issues, versus when we're talking generally about ACEs, when I go back to saying that just because a child experienced something does not mean that they will have any of these health issues. When we're looking at data, we're able to make those specific connections. So what we know from the report is that Kansas adults with high ACE scores, which they're saying is experiencing 3 or more, had a significantly higher prevalence of these health risk factors, poor health indicators, and chronic conditions. So on here, it's definitely, again, like that wide range of not just health or mental health, but social outcomes that they are asking about. And interestingly enough, from this data, they were able to say that there was no significant difference in the prevalence of these health conditions, which include cancer, coronary heart disease, diabetes, heart attack, and stroke. So we are able to see and kind of differentiate what health conditions are we able to say are associated with experiencing these higher ACEs. It's not always going to be this blanket of, you know, all health conditions. And so we know that from this data. And this is another way to look at it that they have presented to us. So this is the number of adverse childhood experiences reported from 0 to 8, because again, they don't include all 10. So we can see that at 0, 45% of these adults surveyed had never experienced an ACE. What I do like to point out here is that when we're talking about the previous slide about the prevalence of all those different health conditions, when we're saying 3+ ACEs, conservatively just looking at 4 to 8, that's close to 21% of the adult population who currently have those health conditions. And so, yes, it's great to look at, you know, these lower ends of numbers, but when we're really talking about people who've experienced a high number of ACEs, it's a significant portion of our state population. And because it is included in BRFIS and this is all BRFIS data, we're actually able also to see that the results seen in Kansas mimic the results seen in other states. So I really like to just, you know, it's easy to get fooled by these numbers. You know, you see just smaller percentages, but when we combine them to think about people who are experiencing those higher prevalence of health conditions, it really ends up being a significant amount of adults. And here I have KCTC data. And I wanted to include this because, yes, we don't have that recent data on the prevalence of ACEs in Kansas adults, but we can look at other data that we're currently getting, that we currently have access to indirectly understand how ACEs are occurring in Kansas right now. So this is just one question that gets included. Has anyone in your family ever had a severe alcohol or drug problem? They respond yes. So this is really getting at, we're asking kids, we're asking youth directly, are you living with someone who, or does anyone, assuming that they might live with them, currently have a substance use or substance misuse issue? And we wanted to point out, bringing into 2020 and 2021 data, that there are differences, and it's really unclear because of COVID what these differences mean. But really, the overall picture is looking at within Kansas, across the counties, the percent of youth who are reporting yes to this question varies, as it does in so many ways. You can see that there is, even by county, one county next to another, you might have youth who are at the higher end of reporting yes, and right next to a community that youth are reporting a lower number of them are reporting yes. So this is one way that if we're thinking, okay, well, how can I figure out what is currently happening in our communities? Thinking about different ways that we can use data we currently have that is recent to give us that broader understanding. And just really briefly, I'm not going to get too far into this, but it would be remiss to not talk about ACEs and COVID-19. As we now understand, COVID-19 in and of itself is a huge societal, community, cultural event that is happening to all of us. And I will include this link in an email I send out after with resources. to this webinar that was about helping children thrive, the COVID-19 pandemic impact on health and well-being. It really just outlines a lot a lot of the different information that we know to be true. So it talks about how 1 in 6 children face mental health conditions before COVID-19, but now we know that the impact of the pandemic has only worsened mental health for children, how poverty rates have increased, lack of childcare. I feel like I hear that all the time. It's become such a big issue, and it's going to be impacting families. It's going to be impacting youth, the education and digital divide. Not only all the different changes that are currently happening within education, but also understanding that this digital divide, something as simple as access to Wi-Fi, is more pronounced for children in rural areas who identify as Black, Latino, and Native Americans. They are going to be experiencing just such a wide division in resources that they're able to access. Food insecurity has increased, housing insecurity has increased. And just to end, something that I am positive that we will continue to see data on for years to come is the increase in intimate partner violence and the increase in child abuse and neglect that has been occurring during this period, specifically thinking about how when people are in their homes, when children are no longer going to different activities, engaging with different adults, that means they're having fewer contacts with people who could identify the warning signs. And so, yes, in the years to come, I think we will continue to talk about this time period and be able to understand more about how it is influencing adverse childhood experiences. So moving on to our last part, preventing and balancing ACEs. So again, now you have all this information. Maybe you've heard a lot about ACEs before in the past. What can we do about it? And the really cool thing is that there are things that we know that can balance ACEs out and maybe even prevent them from occurring. And those are our protective factors, specifically positive childhood experiences and resiliency. So taking a little bit of a closer look into positive childhood experiences, research has shown that there are 4 broad categories of these experiences that encourage health, functioning, and quality of life outcomes. Those include nurturing and supportive relationships, safe, stable, protective, and equitable environments to develop, play, and learn, constructive social engagement and connectedness, and social and emotional knowledge. And when we think about, okay, cool, we know those things. When we connect them and we're able to see how they lie against that social ecological model, the different levels that are at play in our societies, we can see how each of these connects. So children experience positive experiences within the context of their family unit. The family unit is able to provide or give access to positive experiences that influences their development. Because again, kids rely primarily on adults in their lives. And the family unit's ability to provide positive experiences is based on the communities and societies, cultural, health policy, and environmental factors of where they live. And so when we think, so you can just see there's different ways that you can focus in on the different levels of our social ecological model. And the next positive factor, protective factor, is resiliency. I feel like this is a super common definition, the ability to respond positively in the face of adversity. I would like to invite everyone to consider this alternative definition, the capacity of a dynamic system to adapt successfully to disturbances that threaten the system's function, viability, or development. And I find this definition really powerful because as humans, we are dynamic systems. When we're talking about building resiliency in children and how this is a protective factor, we are acknowledging that as a child, that they are dynamic. They're complex as all humans are, especially as we grow into adults. And so when we're talking about how can we build resiliency, we're really asking, how can we teach children to adapt successfully to these disturbances and these adverse experiences that really are threatening their development, that threaten their ability to function within the family and within their communities. And so very similarly to the positive childhood experiences, research has validated 3 areas that increase resiliency and can make quantifiable differences in people's lives. Those include support responsive relationships with children and adults, strengthen core life skills, and reduce sources of stress in the lives of family and children. And again, tying it back to that model, this really ties into, if you get into resiliency research, the 3 different levels that that programs can focus on. So that individual resiliency, strengthening core life skills, family unit resiliency, teaching, working with adults to help them understand the importance of having supportive relationships with children in their lives and being able to respond and provide coping and provide comfort when children are experiencing adversity. And community level resiliency, which again ties into the reducing sources of stress for in the lives of children and families. And this, I'll be including an email, Nancy will be including these in the chat. As there is an ACEs questionnaire, there are so many different resiliency questionnaires out there that we can use as tools to understand where we're currently at in our ability to be resilient to adverse experiences. And so all this tied together, what could happen if we prevent ACEs? As you can see, we would see reductions almost across that wide range of mental, physical, and social outcomes, fewer cases of depression, heart disease, and obesity, as well as like I was saying, those social outcomes, reduction in the number of adults who are unemployed. There's a lot of positive outcomes that we can see when we work to prevent ACEs. And the great thing is that there is so many programs, there's so much work currently out there who is doing this. They're looking at how can they prevent ACEs, whether that's from an approach of reducing those society levels, like creating positive childhood experiences, all the way to those individual levels that you see here, like Lemonade for Life. That is something that an individual can do to better understand the ACEs they have experienced and how they can overcome them. There's such a wide breadth of resources out there, and we are excited to be able to share these with you. We'll be releasing a toolkit where you'll be able to see those links to those different programs, links to these surveys that I talked about here today. And that is where I end. Thank you so much for joining us today. I hope that you were able to learn something new. And as I said, please feel free to drop any questions or stay if you have any questions. I will be hanging around for a few minutes. So thank you for joining us today.
Hey, Elisa, you did have one question in the chat. Lori says, a child might enter into a toxic state. What is the time period when a child enters this toxic state and the concern becomes harmful? Looking for an amount of time staying in the toxic zone when it becomes harmful.
Yeah, so I am not sure that there is like a definitive like time range that research shows. So it's not like, if they stay in this zone for for a day, we're going to see these effects. It's really thinking about, I think, reframing your question a little bit. We want to think about how long is a child going without a supportive adult relationship, without getting the help they need to learn how to cope and understand the experience that they're having, so that their body can move out of it. And so obviously, I think a lot of the research points to when we are existing in a toxic stress state for weeks, months, years, the longer it goes on, you're going to see, we're going to understand and see how development changes. So I don't think there's a great answer to that, unfortunately, but I would say that from my understanding, really, we want to be able to focus on getting children access to supportive relationships, to really learn those coping skills as soon as possible. I hope that answers your question.